What we have learned is that in myelofibrosis, there is often deranged signaling of ACVR1. And then you see ALK2 is involved here, but often we're referring to ACVR1. And this is a really important regulator of the production of hepcidin in the liver. There are therapies emerging to address this. The way that I think about this as somebody who's not a molecular biologist, I don't do laboratory research, but I certainly have to know something about some of these pathways. When you have this dysregulated ACPR signaling from myelofibrosis, that causes more production of hepcidin. And what happens there is hepcidin is the master's regulator for iron availability and metabolism. So when you have too much hepcidin, it sequesters all the iron. The patient is not iron deficient in the body, but they are deficient in iron that's available and accessible for the marrow and for the cells to use. If you could do something to restore more normal signaling of ACVR1, you could then decrease the hepcidin levels, increase iron availability, and thereby actually decrease anemia. And you can't necessarily do that by just giving somebody iron because the hepcidin sequesters it. Now, this isn't the only mechanism of anemia in myelofibrosis. You can have sequestration of red cells in the spleen because it's so big. So I think of it as like the body's oil filter, and it's as if you went, 55 years without changing the filter in your car. You could keep changing the oil, but eventually the filter becomes a problem. It gets clogged up with gunk, and it doesn't matter if you have good oil. Like you can give a red cell transfusion, but if it's all going to get caught up in the spleen there, the more accurate term now is anemia of inflammation. And it's because the cytokines actually upregulate hepcidin through the ACVR1 pathway. And that can cause impairment as well in erythroid differentiation, where you have immature red cells that don't grow up into more mature ones that then go out. So, these three things, this is sort of the trifecta of anemia and symptomatology